Je m'appelle Rosalie. Depuis que j'ai quitté Lubumbashi, j'étais toujours malade. J'étais toujours malade, ni à boire, ni à manger. J'ai souffert beaucoup avec la maladie.
Moi, c'est maman Alphonsine. Mais il y a boire non, mange non. Il y a les kinères. Il est par le kinère. Docteur Mangla a fait que papa Mani, il est soutenu pour les maladies des enfants.
Esophageal or food pipe cancer is commonly seen in our country and worldwide. The most common variety being squamous cell cancer. It is most commonly seen in relatively older patients more than 50-60 years of age, but sometimes it can occur in young patients. The commonest symptom is inability to eat or swallow, difficulty in swallowing, also called dysphagia. Sometimes these patients can have so much dysphagia that they'll end up losing a lot of weight, and by the time the disease is diagnosed, they're really emaciated. So is the story of a young girl, Rosalind, who came to us from Congo all the way for her treatment. When she came to us, she weighed about 20-25 kgs, absolutely skin and bones, because she was just not able to eat, just not able to swallow. The first thing we realized in her was the most important thing was to get nutrition into her, for which first an endoscopic nasogastric tube was placed for feeding. This was followed by doing the required evaluation. She was treated with chemoradiotherapy initially, like is recommended for all squamous cell cancers of the esophagus. Subsequently, this patient underwent a thoracoscopic surgery or keyhole surgery, in which the diseased part of the esophagus was removed and her native stomach was used and pulled up to the neck to restore the swallowing. The management of the case was further complicated by the fact that because of her low weight and her inability to walk, she developed venous thrombosis in the leg, which was extending till the abdomen. And we had to really give her a lot of anticoagulations while she was getting her chemoradiotherapy, not just then, but also while she underwent surgery. Doing the surgery for esophageal cancer by keyhole or minimally invasive laparoscopic or robotic techniques helps ensure that the cuts are small, the patients recover faster, the pain is less, the wound infection in the hernias become much less. So the advantages of minimally invasive or laparoscopic thoracoscopic surgeries are very well accrued in patients with esophageal cancer, and nowadays, as we routinely do, esophageal cancer surgery is also done the same way with small cuts laparoscopic surgery, just like a gallbladder surgery is done. This patient recovered very nicely, and within 6 to 7 days of surgery, she was back to the hotel and she's now recovered very well. 3 months down the line, she's gained a lot of weight, gained a lot of confidence, is rid of all kinds of feeding tubes, and is now preparing to go back to her native country. We wish the patient and her family safe travels back home, and then best of health always.
Merci beaucoup, Dr Mangla. Merci beaucoup, Papa Manil. Merci beaucoup, tous les services. Merci de l'hôpital de Charlie. Merci beaucoup, tout le monde. Que Dieu vous bénisse tout ce travail que vous avez fait.